I'm going to perform insertion of fine bore tube to my patient, but before that, I'm going to make sure to check if the scene is safe. Check if there's any cords, cables, or clutters that may cause harm to my patient and the rest of the medical team. Now I can confirm that the scene is safe. I'm going to do my hand washing using the 5 moments of WHO standard. So first, I'm going to put a palm full of product in my hands, rub it for 20 to 30 seconds, palm to palm, back of my hands, finger interlace, fingers interlock, tips of my fingers in a rotational manner and vice versa, rotational rubbing of my thumbs and my wrist. Once my hands are dry and clean, I'm going to approach my patient in a kind and professional manner. Hello there, good morning. My name is Netsi. How are you today?
I'm good.
What do you want me to call you?
You can call me Anne.
Hello, Anne. I'm here today because I'm going to do a fine bore NG tube insertion. But before that, I'm going to check. Are you comfortable?
Yes, I am.
Are you warm enough?
Yes, I am.
Can you hear and see me clearly?
Yes, I can.
Right, so after that, what I'm going to do is going to make sure that I've checked the identity of my patient, which includes the name and date of birth of my patient, the hospital number, the allergies, check the privacy and dignity of my patient, and gain consent. Once it's all done, I'm going to explain to Anne what I'm going to do. So Anne, I'm here today because your doctor advised me to insert a fine bore NG tube in one of your nostril. So this is to aid with your feeding as of the moment. But before that, is this a convenient time for me to do it?
Yes, this is the time.
And are you happy for me to do it?
Yes, I am.
So once I start inserting the fine bore NG tube, it might feel a little bit uncomfortable and it can be painful as well. But don't worry, if it's too much, can you raise your hand for me so that I can remove the NG tube or can stop the procedure straight away? Right. Is that okay?
Yes.
So, Anne, I'm just going to prepare all my materials. Here's the coral bell. If you had any problems or if you need me, don't hesitate to call me. So now I'm going to prepare my materials. First, I'm going to check if my tray is clean, disinfected for the last 24 hours. Accessories is safe for me to use.
Yes, safe to use.
Thank you. And my gloves, clean, dry, and intact, expires on 10/20/23, safe for me to use. My hand gels, clean, dry, and intact, expires on 12/20/23, safe for me to use. My warm water, it's clean, and I'm going to use it as a lubricant. But if there's any specific lubricant, according to the manufacturer's guidelines of the NG, I will use it as well. Next is my NG tube. It's clean, dry, and intact, expires on a 12/20/26, safe for me to use. Next is my aspirating syringe, clean, dry, and intact, expires on 10/20/25, it's safe for me to use. Next is my NG tape, it's clean, dry, and intact. It hasn't got any expiry date, but in actual setting, I'm going to get it from the box which has an expiry date. Accessories, it's safe for me to use.
Yes,
thank you very much. Next is my paper towel, it's clean, dry, and intact. I'm going to get it from the box which has an expiry date. Accessories, it's safe for me to use.
Safe to use.
Thank you. Next is my pH strip. It's clean, dry, and intact, and it expires on 12/20/23. Safe for me to use. Next is my marking pen. Make sure that this is in a good working order. Safe for me to use. Next one is my scissor. It's clean, dry, and intact, and disinfected in the last 24 hours. Accessories, it's safe for me to use. Thank you. Next is my kidney basin. It's clean, dry, and intact. I'm going to use this as a receiver, and I'm going to use it as a sick ball as well, just in case my patient's vomited. Accessories, it's safe for me to use.
Yes, safe to use.
I'm going to get my apron. I'm just going to put a hand gel first. I'm going to make sure that this is clean. And I'm going to make sure to put it, making sure that the clean side is facing my patient. Go into my patient room, disturbing the curtain as minimal as possible. So hello there, Anne. I'm back. I've got all your materials for your NG tube insertion. How are you doing?
I'm still good.
Are you still happy for me to perform it?
Yes, I am.
Okay, thank you. So what I'm going to do now is I'm going to ask you to check the patency of your nostril. So if I can ask you to sniff in one of your nostril, but making sure that the other nostril is closed, can you do that for me?
Yes, I can.
Can you do it now? That's good. And can you do it on the other side as well?
Yep.
Okay, so which one is more clearer?
My Left nostril.
Okay, so that means that we're going to use your left nostril. So I'm going to make sure as well that I'm going to reposition you. It's good that you are in a semi-upright position, as that's the easy position when we're inserting the NG tube. So I'm going to make sure as well to put the pillow behind your head to support it from tilting forwards and inwards and backwards. So hand gel. So I'm just going to make sure as well that there is a working suction and oxygen by the bedside of the patient, just in case of emergency. So now I'm going to measure my NG tube. So first, I'm going to put a hand gel, put my gloves on. And I'm going to open my NG tube and put the rubbish in the domestic waste bin later. So now I'm going to measure my NG tube from the bridge of the nose to the earlobe, and from the earlobe to the bottom of the xyphisternum. So this is 52 centimeter. I'm going to add 5 to 10 centimeter. So at this time, I'm going to add 5 centimeter. So 52 plus 5 is 57 centimeter. And I'm going to put a mark on it. So 57. That's done. So now what I'm going to do is I'm going to lubricate my tube 15 to 20 centimeter. So now lubricating it, and I'm going to put the end of that NG tube in a receiver. Now I'm going to insert the fine bore NG tube. Now is that okay?
Yeah, that's fine.
Right. So and I'm just going to insert the proximal end of the NG tube, sliding it inwards and backwards along to the floor of the nose to the nasopharynx. Check if there's any obstruction. If there is, I'm going to use a different nostrils or use the different direction. Since there's none, I'm going to continuously ask the patient to swallow. And can you swallow for me?
Yes.
As the tube passes down the nasopharynx to the esophagus, then I'm going to advance the tube up until it reaches the pharynx, and it reaches through the marker indicator, which is 57 centimeter. So check if there's any signs of distress. Since there's none, distress just like coughing or breathlessness. Since there's no signs of distress, I'm going to check Anne. Anne, are you comfortable?
Yes, I am.
Okay, so we've got the NG tube now in there. So what I'm going to do is I'm going to secure the tube. Is that okay?
Yeah, that's fine.
Right, so now I'm going to secure the tube by getting a NG tube tape. Right, and I'm going to put it in your nostril. Right, so I can also put an hypoallergenic tape into my patient's nose cheek to prevent pressure from the nares. So, Anna, are you comfortable now?
Yes, I am.
Right, so what I'm going to do now is I'm going to do an aspiration of my patient's pH. This one goes, the wrappers goes to the domestic waste bin later. Check the functionality of the NG syringe. So what I'm going to do now is going to aspirate by opening the cup. Aspirate 0.5 to 1 ml of gastric juice. So once done, I'm going to cover the cup. Are you okay there, Anne?
Yes, I am.
Right, so I'm just going to check it now. So Anne, I've finished with insertion of your fine bore NG tube. Everything is doing okay as of the moment. So are you okay?
Yes, I am.
Right, so Anne, here's the call bell. If you need us or you need anything, please don't hesitate to ring your orange button, okay?
Alright.
In actual setting, I'm going to change my gloves so as not to contaminate the pH strip. So once I've changed my gloves, I'm going to get one pH strip and put it on my paper towel. So I'm going to make sure to put the NG aspirate covering all the pH indicator. So now I'm going to count 10 to 60 seconds for the result. It's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So now I'm going to check the pH. So the pH is 3. So this means that the NG tube is in the right position. So Anne, your pH is 3. That means that the tube is on the right place. So before we start feeding you, we need to make sure that we check your pH every time to check the placement of the tube. If the pH result is 5.5 and above, I'm going to redo the test. But still, if it's still 5.5, I'm going to ask the doctor or inform the doctor so that he can request a radiological test, which is a chest x-ray, to check the tube if it's in place. So Anne, I've finished with insertion of your fine bore NG tube. Everything is doing okay as of the moment. So are you okay?
Yes, I am.
Right. So Anne, here's the call bell. If you need us or you need anything, please don't hesitate to ring your orange button. Right, so now I'm going to tidy up all my materials. Everything that touches my patient, including my gloves and my apron, needs to go to the clinical waste bin. And then the wrappers needs to go to the domestic waste bin. The rest of the material will be clean and disinfected, ready for the next use. So once done, I'm going to do my final hand washing and my final documentation that I've explain the procedure to my patient. I gained my patient's consent. I provide privacy and dignity. I've inserted the fine bore NG tube to Anne's left nostril with 57 centimeter at the end of the nostril as an indicator. And the pH is 3, which means that the tube is on the right position. And then there is no signs of any distress like coughing or breathlessness. Now I'm going to do my final hand washing and leave the room.